and good morning. Let's go ahead and get started. I see Shendels and Bonnie and Becky, and actually, Sarah, do you want to introduce that other person who's joined us?
Oh yeah, my mom is here today. Yeah, from Bruce. So that'd be about halfway between you and I, Paul, Menomonie and Hayward. Bruce is right on the way.
Yeah.
Yeah, or Ken on the way, depending on the route you take. Yeah.
There you go. Well, thanks.
He's my biggest fan.
Well, I'm thankful for everybody for joining. This is a continuation of our monthly health ministry forums, health ministry education sessions. Last month in September, Drs. Adam and Andrea Miller recorded a nice talk about vaccinations, focusing on adult vaccinations. We were a little delayed, but we eventually got that posted up on the church website and on the YouTube site, so you can go out and watch that. This month, we're trying it live. So Dr. Sarah Chambers has agreed to speak with us. Her husband, Mark, is off hanging with the kids, so Sarah is here with us.
No, he's
Just a brief introduction. Sarah grew up in Bruce. She's been an almost lifelong Wisconsinite, save for a brief period where she was out in California. During college, she picked up some psychology and anthropology and underserved minority experience there, which sounds amazing, and I'd love to explore at some point later. But ultimately decided she couldn't be too far from home and came back to us here in Wisconsin and has been at Cedar Creek since 2010. Is that right, Sarah?
Yeah, or summer of 11. Yeah.
Summer of 11. Sorry, I was off on that date.
No, that's okay.
Anyway, she and Mark are dentists at Cedar Creek and has agreed to talk to us on kind of general dental health topics. And with that, I will pass it over to Sarah.
All right. Well, thank you, Paul, and thanks for letting me do this. It allowed me to actually do a little research too, because what I want to focus on today is called mask mouth and how the pandemic is affecting oral health. Because there are things that are happening because of our mask wearing, and how is that changing the environment of our mouth, and what we can do to combat that, to keep our mouths as healthy as possible. So, all right, so I'll start here. So mask wearing what it's doing is it's causing mouth dryness, because when we wear a mask, we're breathing through our mouths and we're drying our mouths out. So saliva is becoming less present. And saliva is so important because it's critical to keeping our teeth clean. It's critical to keeping our mucosa in our mouth wet, and it flushes away any food debris. So when we don't have saliva, we really open up a box of potential problems. 4 problems that we're finding in the dental industry now that we've been wearing masks as a nation for 5-6 months is we're seeing a lot of inflamed gum tissue. So when people come in for their cleanings, and the hygienist will be probing, measuring the gum tissue, they're finding that a person that normally has 3s and 4s may have more 4s and a couple 5s. So their gum tissue is just puffier, and it's angry because it doesn't have saliva to coat it. The second thing is because saliva is not as available in the mouth or prevalent, we're seeing decay pop up on people that normally don't get decay. Or we're seeing decay pop up by the gum line, which is very much in line with a person that has less saliva, because at the gum line is where you can get root exposure, and root is in its makeup more porous than enamel, and so that's the first part of the tooth that will decay because it's softer. The third thing is people are complaining, I have bad breath. Why do I have such bad breath? Or I put my mask on and it's terrible. And what's happening is when you're wearing your mask, you're drying your mouth out, and bacteria are able to populate, and they're causing bad breath. And so mask wearing is definitely a problem in that regard. The fourth thing that we've seen before, we see a lot on denture patients, is called angular cheilitis. And that's when the corners of the mouth will become moist and fungus will grow. And that's common for a patient that has dentures because they'll be overclosed, and then this part of their mouth will fold, and then moisture will accumulate, and they'll get a fungal infection there. But now that we're wearing these masks, we have a very humid environment over our mouths, and that humidity just will cause fungus to overgrow. What you can do is, it's a very easy treatment, but clotrimazole cream, and I have it right here. It's athlete's foot cream. You can buy it at the store. You can just dab a little on the corners of your mouth if you find that it'll feel like it's cracking and there's sores there. And so you can treat that at home. All right, so we're seeing those four things change in the mouth. We're also seeing patients come in and complaining about clenching and grinding, that they're stressed and their muscles of their face are very sore. They're waking up in the middle of the night with headaches, and they're really just clenching and they're grinding their teeth. And so they'll complain of sore muscles. They'll complain of, we'll see patients with fractured teeth because of the habits that they're doing. And we're seeing changes in jaw health, where a patient, when they open and close, who never had clicking or cracking sounds, will have developed those. And that's just a change. That's a sign that their jaw health is changing, and they're putting too much pressure on their joint, and that we need to talk about what we can do to help that. So remedies, that's where we're at now. Remedies to these concerns. So how do we combat mouth dryness and its negative effects? That's why we're here today, because I want to help do all I can, because masks, they're not going away. We're going to be wearing these for a while, especially in the dental industry. I don't know if I will ever actually greet a patient again without a mask on, because I'm close to them, and it's just, I'm working, I think, at ground zero. Like, I'm in the mouth. Like, not a lot of people, are seeing people's faces or seeing people's smiles during this time, but I'm not only seeing them, I'm working in them. So in our industry, we're wearing N95s the whole day, and we're layering on a surgical level 3 mask over the top. And we're changing these out every patient, but then the N95 stays on like skin, so that we have a barrier protecting the patient, and then also just protecting us. And so all this information is critical to dental employees, because we're wearing masks 8 to 9 hours a day, and it is causing a problem. So, all right, so the first thing we can do is drink a lot of water, and that's nothing new. That's just something we gotta always do. But when you have too tight masks on, trying to drink water isn't the easiest thing. So I don't know if you want to, use a straw, and then when you're wearing your mask, you can just okay, do this type of thing. And now that's probably, and we can't really do that. We have to actually take our gloves off, take everything off, wash our hands, drink our water, and then, get resuited up. So water drinking is not really happening as much as it should, because it's a lot of work. The next thing you can do, and it is swoosh with products like Biotine. And I'll show you that. This is before all this mask wearing has started, patients that had dry mouth from medications, we would talk about Biotine and things like that with them. But now this is important for mask wearers, because what Biotine does is it locks in the moisture, and it also gives you moisture too. So you could definitely, before you put your mask on for the day, rinse your mouth with this, swish it for a minute, and that can help just seal the mucosa of your mouth and lock in that moisture for the day. Some patients have also told me about like coconut oil, and that they'll take some and just coat the insides of their mouth, under their tongue, before they sleep at night. Now, these are patients that have dry mouth because of a medication they're taking. So we luckily can take our masks off, and then we get our saliva back. and we're good for the night. But these are patients that do live like this. But now we need to, take hints from them because we're dealing with dry mouth during the day when we're wearing masks. So those are a couple products that can be used. The big thing I want to talk about today is the pH of the mouth and how we can best control it, so that we can stop cavities and keep the mouth as healthy as possible. So what we need to think about is how we can increase the pH of our mouth as much as possible, because every time we eat, every time we sip on coffee, every time we grab a snack, our mouth pH is becoming more acidic. And in an acidic environment, that's where we get problems. That's where we get tooth decay. And that's where we get bad breath. And that's where we get inflamed gums. So we need to keep that pH as high as possible. So things that can be done are, well, rinsing with water. So if you don't have any products around, just when you're done eating, rinse with water. Water has a pH of 7, and that's going to at least bring the acidic mouth. Maybe you're at a 6, maybe you're at a 5.5 after you eat. Rinse your mouth with water. That's going to help flush away the food debris, and then that'll keep your pH higher. An awesome product that is out there is called TheraBreath, and you can get it anywhere. Walmart, Target, Amazon, it's everywhere. The pH of TheraBreath is 8.2, and that's a big deal because a lot of the mouth rinses that are popular, like Listerine and Scope, Listerine has a pH of 4.3. That's far too acidic. That's going to cause acid erosion, enamel erosion. Scope is 5.4. These are frontliners. Everyone has this in their house, but they don't know the pH of it. And that's where we can cause problems in our mouth. So, I would just be aware of those. Not that I'm telling you just never buy that, but gosh, if you can buy a product like this, it's going to help keep your mouth as basic and therefore as healthy as possible. So, okay, so we have TheraBreath. And this is important to know too, is a lot of people will swish with Listerine or Scope when they're all done brushing and all done flossing. This is to be used as a pre-brush rinse. So before you even brush, you're going to swish with this for a minute. Swish, 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 because you're changing your mouth pH to be more basic. Because then when you end up brushing with your fluoride toothpaste, and I'll talk about this too here in a second, fluoride cannot work in an acid environment. So what's the point of brushing with just after? If you brush after you eat, your mouth is very, very acidic. So you're not going to be getting any effects of the fluoride. So you're going to swish with this first, and then you're going to brush with the fluoride toothpaste. And then that fluoride will actually be able to work. And you're going to not want to brush for 20 minutes after you eat, because if you brush too early, you're only debriding the teeth. You're not going to get any effects of the fluoride. So keep that in mind too. After you're done eating, wait 20 minutes and then do your brushing and rinsing. All right. So products to best debride the mouth of food debris and plaque. This is nothing new, but there's the electric toothbrush out there. I remember when I was in dental school, they gave us these and I was like, really? We need a machine to brush our teeth. There's just too many products out there. However, they made us use them and they gave us all different sorts of brands. This is Sonicare, and Sonicare and Oral-B are the leaders in electric toothbrushes. And Sonicare, the brush head actually looks like a toothbrush, where Oral-B is circular. And so, people tend to like this one more because it actually looks like what they have. And they have found lots of research that when a patient uses an electric toothbrush, they are debriding their teeth better and their gum tissues are healthier. And it can vibrate in a pattern, in a motion that we can't replicate with our own hands. So this is a good product. And you don't need the top of the line, like $100 electric toothbrush. You can get a very basic model, $20, $30, and you're going to be well on your way. So they come in, there's the adult one. They even make little kid ones, which are pretty neat. So yeah. So electric toothbrush is very big. Another thing is the water pick, and I'll show you this. This is the one that sits on the counter, and it plugs in, and it's got a reservoir for water. So you fill this up with water, and you put it right here. Warm water tends to be better because your teeth won't be so like get cold. And then it's got a like a little thing. Now this is like the bigger model, which honestly, if I were to recommend one, my mom has one that I gave her that is a handheld one. And it's got a little reservoir and it charges, but you can bring it in the shower. This thing you can't bring in the shower because it's got electricity. So you don't want to do that. It's pretty messy too. Like you're going to turn it on and it's a little squirt gun and it just, it goes. And you can change the speed, up to 10. It's pretty powerful, but it also just debrides the teeth of debris. And that's the whole name of the game here. Get that food debris out of there, because when bacteria in the mouth eats it, it produces an acid. And then we get back to that acidic mouth, and that's where problems happen. So it's all about just getting that food out of there. I love to snack too. So I'm like the worst at this. Like I'm constantly introducing food to my mouth and lowering my pH. And then I put on these 2 masks and I'm afraid for my next dental appointment, see what happens. But anyway, so yeah, so the water pick is a great thing. And again, you don't need a high-end model, just a nice handheld one that you can use. Some of the research will say water pick is even good enough to replace floss. I don't know about that. I still feel like, I don't, yeah, you can, I mean, if you're just like, I'm not going to floss, no way, but you pick up the water pick, I'm happy with that. But yeah, I don't know if it's quite at that level yet. Okay, so we have water pick. Tongue, what about the tongue? I never brushed my tongue till like dental school. I didn't even think about my tongue until they talked about a tongue scraper. So the tongue has all these little filaments on it, and it collects bacteria and it collects yeast. And so you can get oral thrush, and that's where you have an overgrowth of yeast on your tongue. And that can, so you need to get rid of that bacteria and yeast, and you just scrape your tongue, and then you can brush your tongue too. Because we don't want you to do a great job cleaning your teeth and your gums and then have your tongue repopulate that bacteria in your gums and your teeth. You're just moving backwards here. So make sure you debride your tongue as well. All right, let's see. Wow, we're just clipping along here. Hopefully everyone's having a great time. Fluoride trays, look with me here. Thank you, Becky, for the thumbs up. So if a patient is we're seeing a lot of cavities by the gum line, and this is like what we've dealt with before masks on patients that experience dry mouth due to medications. We'll see cavities pop up by the gum line, and we're frustrated, they're frustrated. I don't want to do fillings on them. They don't want fillings. What do? What we'll do is we'll make clear trays for the patient, and they will, before they go to sleep, line the trays with this 1.1% sodium fluoride toothpaste. This is a prescription. We sell it at our office. It's not that expensive, but it has about triple the fluoride that a regular toothpaste has. So you put that in the tray, and then they wear it at night, and it just keeps the teeth wet and moist. And fluoride is readily available for that enamel to soak in, and then that protects the teeth, because if they get dry at night, which they do in patients with dry mouth, that's a breeding ground for bacteria, and then we get cavities. So that's another thing we can do, fluoride trays. And then the fluoride helps remineralize those areas to help decay form. And the fluoride actually makes the tooth stronger and more acid resistant. And so that's why us dentists like fluoride. And I know a lot of people, don't like fluoride, and that's fine. But we just know chemically that it exchanges an ion in the tooth structure. So the tooth is actually more resistant to decay. All right, so there's that. What else do I have? Okay, clenching and grinding. Like I said, we're seeing patients come in and they're saying, I am waking up with the worst headaches. My muscles are so sore. When I open and close, I get this clicking and popping. What is going on? And they're clenching. They're clenching. This is a very stressful time in a lot of people's lives, and they're developing habits that they've never had to deal with in the past. And so there's a few different things we can do. The first thing we talk to them. Just being aware of the habit is first and foremost, because anything that we know we're doing, we can somewhat help to not do. Because some patients will clench, truck drivers will clench when they're driving. It's just a thing they do. So if they know they do it, they can maybe try not to. And that only goes so far, because our minds are powerful, and we can do about anything we want to if we try, if we try hard enough. So what we'll say, tongue between the teeth habit. So you're like, I'm a clencher. When I drive, I'm just going to try to keep my tongue between my teeth. And then you're at least biting your tongue when you try to clench, and that stops you because that hurts. So that's another just thought that us dental people will talk about. And then when we determine that you are clenching and grinding, we try to figure out, is it a daytime habit? Is it a nighttime habit? Because if it's a nighttime habit, it's virtually impossible for you to just not do it because you're sleeping. So if it's a nighttime habit, we can make guards with a lab that protect the teeth. Now, I often tell my patients, go to Walmart, go to Walgreens, see what they have there, because if an over-the-counter guard that fits kind of like a sports mouth guard, if you can put it in warm water to get it pliable and then put it in your mouth to shape it, and if that works, perfect, because that'll save you money and you can get it today. So I always tell people, try that first. If it doesn't work and they take it out at night, then come to me and we can talk about what we can do. And we can take a mold or an impression of your teeth, and then the lab will make this clear splint. It's thermoplastic, so when it's in your mouth, it's somewhat squishy. But it's just crucial, because then you have a barrier between your bottom teeth and your top teeth. So if something wears, it's the guard, not your teeth. We don't want your teeth to wear, because we can't ever build that back without, doing dental work. So these are pretty darn popular for patients. And once you get used to them, you can't sleep without it. So another thing, fabrication of a mouth guard, massage just at night if you're coming home sore, just really massaging that muscle to push out that lactic acid and just allow the muscle to relax is helpful as well. And then I always like to talk about chiropractics, because I think they're a component here. And if we are developing a lot of clicking and grinding or clicking from grinding and clenching, a chiropractic visit isn't a bad idea, just for them to evaluate the jaw joint and maybe do an adjustment. Exactly. So yeah, my big thing today is, I think I covered everything, is I just want you to think about the pH of your mouth and how you can best control that, so that when you do wear your mask, if it's 8 hours a day, then you know how to best keep your mouth in the most basic environment so that it doesn't develop cavities. So in a perfect world, I'll tell you, I don't do this, but I should do this. An A+ patient would be, first you rinse with TheraBreath, and you get a nice basic environment in your mouth. And then you brush with a fluoride toothpaste. This is the prescription fluoride toothpaste, but any toothpaste, brush, brush, brush. And then you're going to floss. And that floss, you can floss with floss picks or regular floss. You're going to floss that toothpaste between the teeth, and that is going to coat the teeth so that they maintain, so that a fluoride can bathe and protect all the surfaces. So floss after you brush, and then don't rinse that residue away, because that residue is going to be helpful to keeping the teeth protected and moist. But don't rinse when you're done, because a lot of people will be done brushing and then they'll rinse with Scope or Listerine, and then you've just ruined everything, because now there's no residue on the teeth to protect them, and now you're rinsing with a 4.3 acidic mouth rinse, and you're back to square one. So that's what I would suggest. Yeah, let's see. I think I covered everything. Oh, biotin also makes a gel that you can coat your mouth with, so that can also lock in moisture. So then what I would probably do if I was going to put my mask on, after I rinsed or after I brushed the residue through the teeth, then I would say, all right, let's do this. put a little of this gel on the insides of my cheeks and on my gum tissue above my teeth and below. And now you're ready for the day because you have a basic environment in your mouth and you have moisture from the biotin. And you can just breathe through your mouth. You're going to dry your mouth out, but you've done everything you can to keep it as healthy, to set you up for success. Yeah. Well, thank you for listening. I hope that was somewhat informative and interesting on a Sunday morning.
Sarah, thank you
All
so
right.
much. That was amazing. Really, really love all of that advice. Thank you so much for spending some time on a Sunday morning. We
Yes.
do have some time for questions. Would like to end by about 10:30 or so people have a chance to transition over to the radio broadcast of the service, if that's something you want to do. We've got about 20 minutes or so to ask Dr. Sarah some questions. So I'll open it up if anybody wants to come off mute and ask those questions. Otherwise, I can certainly watch the chat box if that's your preference. Don't everybody jump at once.
I have something else too, Paul.
Yeah.
I don't know if anybody's heard of MI paste. So some patients I've seen recently are saying, what's all this right by the gum line? They're seeing these white little half moons, very chalky when they put their finger across it. It's not smooth like enamel. It's gritty and chalky. And what is that? And they said, well, can the hygienist clean that off? And we said, no, we can't. That's called demineralization. It's not a cavity, but it's right between a cavity and a healthy enamel. It's right here. And so it's very, very porous enamel. So it's demineralized. It doesn't have calcium and phosphate. So MI paste has that. So we have this too, and you can buy this. And you put it on the tooth and it can help remineralize that and hopefully revert it back to a healthy, smooth tooth enamel. So there's another product. Yeah. So much fun.
I'll ask again if anybody has questions. Otherwise, Sarah, I've got a couple that I was jotting down.
Okay.
Actually, Becky, go ahead. It looks like I see you coming off mute.
I was just going to say, I never knew there were so many products out there, and it's so. I think it's the whole pH thing is really helpful. It's not something you think about, and the products that people use, and so I really appreciate all that information about different products you can use. I guess I don't really have a question, but I'm glad we recorded this so I can go back and look again if I need to.
Well, thank you, Becky. Absolutely.
Sarah, a question. One of the things I've recommended for patients in the past, those who have salivary gland problems or duct stones or those kinds of things, is actually sucking on hard candy, particularly lemon drops or those kinds of things. And I'm curious from a dentist perspective what your thoughts are about particularly using hard candy for those who have dry mouth problems.
Love that. See, this is where it gets fun. Just like Nels was talking about how medicine and we should be like at the same. I would love to be part of a hospital or a clinic because there's so much we can work together on. Okay, great question. So, like you're talking about not sugar-free, like sugar-filled candy.
Well, I guess that's another another question to ask.
Candy. Yeah, that is a great question because it's kind of a joke like that. Yeah, people with dry mouth are not a joke, but they suck on candy, which helps the salivary glands because it stimulates it. But it is introducing all this sugar into the mouth, and it's gonna cause problems. Yep. So if but you're right by sucking on something. TheraBreath also makes lage, that word, cough drops that people can suck on, and then it's a basic environment. So if you suck on those little tablets, they taste good, but they also create a basic environment for your mouth. So, or sugar-free candy is fantastic because it doesn't have the sugar, but it does stimulate your salivary glands because you're sucking on it. So I would say that's a great idea, Paul. I would just do sugar-free or ones that you can buy this brand. Yeah. Does that help a little bit?
That is very helpful. Thank you so much.
Yes.
Other questions? Oh, Sally, I think you are muted. I can see you talking. There you go.
Okay. How is dental health related to heart health?
Very good question. Okay, so thank you. I love that. See, there's another connection between dental and medical. When you brush your teeth, there's bacteria that's in the mouth that lives just in the mouth. But when you brush your teeth, that bacteria gets in the bloodstream and it goes all over the body. So if a patient has periodontitis, which is chronic bacteria in their gums, and they brush their teeth on a regular basis, they're constantly introducing mouth bacteria into the bloodstream that goes directly to the heart. And so that can be a detriment to your whole body, because now your body's fighting this bacteria systemically, when if we would just control it at the source by debriding those areas with a dental cleaning, we can then not have to get it throughout the body. So it can be connected when we brush our teeth. It goes in the bloodstream. And so it's very important to start with a healthy mouth. Yeah, did that help a little bit?
Yeah, thank you.
Yeah, thank you for asking. Absolutely. Yeah.
Well, good. Thank you so much, Sarah. Yeah. We've got some time. If everybody's had their questions answered, I'm happy to end us a little early. But if you've got more to talk about, please go for it.
I don't. I just I love, like, when the medical doctors they take the reins and they'll prescribe a antibiotic 1 hour before a dental cleaning, because they know that patient is at high risk for maybe developing endocarditis, which is a heart condition. And so they're recognizing there is a connection between mouth health and the heart. And so they're allowing that. Yeah, they're setting the patient up so that bacteria that gets in the bloodstream doesn't cause heart damage. And so, yeah, so that's another, a good reason to visit your doctor, because they're evaluating you from that perspective. So is it safe for you to have a dental cleaning and the effects of that? Yeah.
Sarah, I want to reach back to your to the conversation we had before we started recording here. It is getting into election season, and just wanted to hear some of your thoughts around access to dental care and payment for dental services, and not asking you to take any particular political stand, but just curious what the thoughts are from a dentist perspective on those topics.
Absolutely. Well, I think a lot of us dentists feel left out. We're not included in Medicare plans. We are in Medicaid, but the reimbursement is pennies on a dollar. And so for us to actually function like that is impossible, because we can't turn a room over, pay our assistant, and see those patients without, doing it at a loss, which we're willing to do. But to do that, half of your day is not a good business model. So if Medicare could introduce a plan that even would reimburse at 50%, that would be tremendous. Then we could, bring those patients into our practices. But a lot of Medicare patients will have private. Well, they'll just pay privately, or just pay out of pocket, or they'll get dental insurances that are, not of the state of a private plan. I would love, though, if it could just be, included, because then it's not such a division in that. Yeah. Thanks
for that. Just one other question kind of along the same lines. We know that Dunn County is one of the less, has one of the higher poverty rates in our state.
Yeah.
I don't know honestly how that translates to people's access to dental care. But I'm just curious if you've got any thoughts or recommendations how we as a community, or we, potentially as a church community, can help assure that people who need it can get in to see you, or your other dental colleagues in the area.
Yeah, absolutely. I think, honestly, just giving a call, and we can do a new patient exam and determine the needs first to decide, okay, well, what do we need? Are there cavities here? Are there broken teeth? Are dentures needed? And then we can figure out how we can get there. If it's developing just a reduction in fees, I love that. That's why I do what I do. I want to give back. And that's why I worked at CVTC Dental Clinic, because they had they worked off of grants. They had to, because if they bill Medicaid, they don't get reimbursed to actually keep the doors open. And that's also Marshfield Clinic in town is absolutely tremendous for that, because they also work off of the same model where they can see patients, and they have a sliding fee scale, so they can easily accommodate a person that may be retired and not have a dental insurance plan and have a lower income because they're retired, and they can give, that filling can be at a much reduced price, which is wonderful. Yeah.
I was going to also ask along those lines, Paul, what you were asking. Could you send us even some resources on what we could pass along to folks who don't have access to dental care, and where they can go? And I know they used to have these days where there'd be a whole day that people could go in, and I don't know that they're doing that yet, but.
Yes, they would do that, and we'd be a part of that. I think it was in in the middle school, like a health day. Yeah, I hope they do that again. But I think you're right, Becky, because of the virus, they're not doing that. But we need to do more of those days. Yeah, but I can definitely get a list to Paul, and we can get that out. Yeah.
That would be great. Yeah, we used to do it. We were involved. It was actually the churches that got that going. It was called Free Health Day. And we did that for 5 years. Yeah, 5 years.
Yeah.
And then
there we go.
It got, more difficult to do because it was on a Saturday, and it was harder to get the providers involved. But it seems like there was one in Eau Claire too. That was a year or two ago.
Yep, it's called Mission of Mercy, and it's it travels throughout the state each year, and it's it's totally, I believe, free to all people, and it's just, you get diagnosed that day, you get treatment that day, you are done. And so I can get that too, where this year's are they going to do it this year? I don't know, but I can look into that. But Mission of Mercy, very good program. Yeah, because it's a problem. Yeah. Absolutely.
Yeah, thank you.
Cool.
Yeah.
Thank you, Becky.
Great.
Very good.
Well, anyone else have questions? Otherwise, let me say that. Does anybody else have questions? Okay. Well, Sarah, thank you again so much. Can't tell you how appreciative we are to hear from you, and hopefully learn some of your wisdom, your experience from the dental world. We will get this edited and put up on the website for people to review there. And then just a quick plug, looking at my notes here, next month, November 15th, we will hear from a couple ladies from the ADRC who will be helping us learn about National Caregiver Month, and how we can work together to provide the care for those in our households and in our community who need it. Becky, I'm just curious if you've got any other comments there. I know you've worked with that group before. Do you have any other thoughts that we can just preview?
Not specifically, and I don't know, are they talking about dementia too, or pretty much just caregiving in general?
Thank you. Yes, dementia caregiving. That's exactly right. I knew I forgot something.
Yeah. The other one is to put in a plug for the one that's on YouTube, the September one.
Yes, thank you. Again, Doctors Adam and Andrea Miller did a nice presentation about adult vaccines. If you're curious about that, please go out to the church's YouTube page or the church website, and they'll have all of that information available for you. Once again, Sarah Chambers, thank you so much. I hope everybody here has a wonderful Sunday afternoon. It looks like it's a beautiful day, at least looking outside my cabin here. We'll end a few minutes early so you can transition over to the radio broadcast service and enjoy the rest of your Sunday.
Thank you.
Awesome.
Thanks, everybody.
Thank you all.
Take care. Have a wonderful day.
You too.
Bye.